Okay, my screen. Good evening, everyone. My name's Erin Murphy. I'm the facilitator tonight, coming to you from Carbondale, Illinois. And I just want to welcome you all to Pre-Health Professions, Interest in Medical School, Dental School, and more. We have a great panel for you tonight, and we'll get them going in just a second, but I do want to let everyone know that your cameras are off, your microphone is muted, but you do have a chance to ask questions and interact with the panelists through the Q&A button on your toolbar, so feel free to add questions whenever, however they come to you. And a couple other reminders, this session will be recorded, so if you have to step away, you can always rewatch it. And more sessions are available along with all recordings at IACAC.org. So we encourage you to take advantage of the many sessions happening over the next couple weeks. Okay, thank you much, and I will turn it over to our presenters.
Thank you.
Thank you. Thank you for joining us this evening. My name is Matt Jones. I have the pleasure of working in admissions at Benedictine University in Lisle, Illinois. I'm located about 25 miles from the city on the west side. And I'm joined here this evening with three great colleagues from Loyola University of Chicago, St. Ambrose University in Davenport, Iowa, as well as St. Mary's, Minnesota, or St. Mary's University, Minnesota, in Winona. For us, we take great pleasure in having you join us here tonight to learn more about pre-health professions. For many of you, you chose this session because you have that interest of going on to medical school, dental school, pharmacy school, physical therapy school, or just have that interest of getting involved in a career in healthcare. And for us, it's really wanting to provide you that knowledge and that information to help you through the college search process, but understand that each of our four institutions, right, service those opportunities through your traditional undergraduate experience to prepare you to get to the chosen professional school of your choice. So with that, right, you're looking at an institution such as our four to kind of identify a major, identify your pre-health interest, to ultimately work towards your professional school, your career aspirations of choice in the healthcare profession. But for us to kind of get started with that, we know many of you, right, are at various stages of your high school careers. And when you look at it, right, it's choosing an institution that services your interest for your career, right? That pre-health professions interest, right? That desire to go to medical school or physical therapy school or veterinarian school. But through that, right, you have to go through your 4 years of an undergraduate bachelor's program, as such schools of the four of us. But as you go through that process, right, it's ultimately kind of identifying that major. Many times we see students, right, they think, okay, I want to go to medical school, so I'm pre-med is my major. And that's not the case for our institutions, right? You choose an academic major that interests you with your passions, your desire, right? Many of our schools, the interest and the identified major that many choose is biology, health science, or something in the sciences per se. But there's many other opportunities that you can do, right? We see many of our students, whether it's here at Benedictine or at St. Ambrose or at St. Mary's, Minnesota, that we see students major in psychology, right? They want that understanding of the psychology aspects of dealing with people, dealing with their patients to really service their interests and passions there. Schools such as Loyola and even such as Benedictine and St. Ambrose and St. Mary's, right? You can also major in something in the arts, theology, philosophy, business, history, anything really from that perspective. We always say the academic major is, right, it's what you're passionate about, what you're interested in. So, right, when you start getting to your junior and senior year of college, right, you're taking some of those courses that are going to be key foundational for your growth across the board within the major. And then comes with that is kind of that pairing, right, that pre-health professions interest, right, that interest of where you want to go career-wise, what you want to do after your bachelor's degree or go on to professional school. right? That pre-med interest, that pre-pharmacy interest, that pre-dent interest, right? Those are the opportunities that are kind of paired there with your major. And for us, it's really going to help you understand that, right? That if a school has that pre-health interest, right, you have that opportunity to go that pre-health route, but then you also have that opportunity to choose a major of your interest from that perspective. And then like all of us, right, St. Mary's, St. Ambrose, Loyola, Benedictine, we're all liberal arts colleges, right? So what that means is not only in addition to your major courses, right, biology, chemistry, business, psychology, as well as your prerequisite courses within the pre-health professions, right? You're also going to take some liberal arts coursework. And for us, we value that greatly. It's going to enhance those soft skills that are so important for your career, so important for your professional school, right? It's going to have that ability to garner that attention to really stem that creative and critical thinking aspects, right? Those strong communication skills, that team building, that networking from those aspects outside the classroom, inside the classroom, from that perspective. But for us, it's really important to understand that, right, you have those opportunities to choose the major of the passions you're in, and then you have those opportunities to identify with that pre-health track of what you want to do with professional sport, what you want to do with career, and what that's tied to. But with that, I'm going to turn it over to my colleague, Mary Alice at Loyola University of Chicago, and she's going to talk more about the opportunities within kind of the prerequisites and preparing you for professional school.
Thank you, Matt. Hi, everyone. I'm so excited to be here today. My name is Mary Alice Berg. I'm an Associate Director of Admission at Loyola University Chicago, and I'm coming live from my office up on the north side of the city. And I worked at Loyola since 2007. I've seen students come in as pre-med, and now they're like actual doctors out there in the field, as well as a whole bevy of other healthcare professions. So I'm really excited to be here today. In the audience right now, I imagine we have sophomores in high school, juniors in high school, seniors, transfer students, and I want all of you to picture yourself now during your junior year of college, on whatever college campus it might be, whether one of our four or another place. And I think it's important as you embark on the idea of exploring the pre-health fields to know what are these professional schools going to want to see from me when I go to apply to them at the end of my undergraduate experience. So up here on the slide, we're just going to walk piece by piece. What are health professional schools looking for when they're admitting students? It's a variety of factors. So the first one are prerequisite courses. Matt just explained to everyone that many students on a pre-health path will pick a STEM or a natural science major, but not everyone will. But every single professional school is going to have a list of prerequisite courses that students need to complete before they can apply into their program. And they list them on their websites. Like if you're a super researcher, you can go check those out right now. To use medical school as an example, most commonly during college, students will need to complete biology, chemistry, organic chemistry, physics, a calculus-based math track, as well as a certain number of additional upper level biology or natural science coursework. So that is the minimum that students need to come in with, along with a bachelor's degree. So just like colleges now are going to evaluate your high school GPA, professional schools in the health sciences are going to look at your GPA from your college experience. But they're going to look at two versions of your GPA. The first one is they're oftentimes looking at your cumulative GPA, like what did you do in all of your classes in high school? But then after that, to put everyone on the level playing field, because they might be coming in from a ton of different majors and programs to this official professional school, they will calculate just your GPA in your math and science classes, and those other required prerequisite courses to kind of see what's that overall GPA, but like, is this student strong in the things that we need them to do if they're going on to continue to be a pharmacist or a physician's assistant or whatever the case may be. Most professional schools schools will require test scores, not all of them, and I listed some of the common test scores up there. So you typically are sitting for these towards the end of your junior year or the summer before your senior year on a college campus. Just like in high school, professional schools will want to see letters of recommendation. Those will come from your professors, they'll come from your advisors, they might come from me if you're giving tours in the admissions office. So you'll gather recommendation letters from a variety of people that know you and can speak to what type of professional you might be in the future in these healthcare settings. Most professional schools do like to see that you've completed some clinical experiences. So oftentimes they'll say, before you can apply to physical therapy school with us, you need to have completed 50 hours of observation in a physical therapy, clinic or setting. Basically, they want to make sure that you know what you're getting into, like what type of field is ahead of you, and that you've done a little bit deeper research than just reading about it online. So they want to see that you have that experience in a healthcare setting. Next, they'll look at your involvement. So you'll submit a resume. So that might include research, leadership roles on college campus. Maybe you don't go right to professional school as a 21 or a 22-year-old undergrad graduate. Maybe you worked for a few years and now you're looking into doing this. So they're going to evaluate that. You will write essays. With the essay, they are getting at the why. Why do you want to become a physician? Why are you interested in going into pharmacy? And they want to see that you've really thought about those questions. And then last but not least, most professional schools will start with their big pool of applicants. They'll do an initial review using the criteria I mentioned to narrow them down. And then they'll invite kind of their top picks on campus for an interview. And if you're invited for an interview, that means the school is really interested in you. And so you're doing research about the program while you're also getting to know people from the different departments and people who might be your future faculty members and advisors and maybe even peers in some situations. We can flip to the next one now. So now that you know what a professional school is looking for when you go to apply, I've kind of now have us taking a step back and saying, well, all of us are going through this college search process. What are the questions we should be asking admission counselors and on-campus visits and online sessions like these to figure out what kind of resources they have for me as a pre-health student? So the first area is kind of researching, what will that advising look like on campus? So a good question to ask might be will I work with a specific office or person? Who is going to help me make sure I'm checking all the boxes that I need during my 4-year college experience to make sure I'm doing everything that I need to do to make myself successful to apply to professional school? At some universities, like at Loyola and Illinois Benedictine, we have an entire office that's working with students on these, we call it the pre-health advising office. So anyone in that healthcare umbrella can work with those advisors there. At other universities, like at St. Ambrose and St. Mary's, they have specific people that are tied to specific programs. So, Professor so-and-so in the biology department might be an expert on pre-med admission. So if you want to go to medical school, that's the person that you're going to go and talk to. The next thing you want to ask, and we have a whole section about this in a little bit, so I won't go into it too much, is you want to ask about any direct admit programs. With these programs, it often allows a senior in high school to be conditionally admitted to both undergrad and graduate school, sometimes saving a year of time and money. So if those programs exist on the different campuses that you're looking at, you definitely want to know about them. Then the next area is thinking about coursework and support. So what are the sizes going to be for my required classes? If you picture a lecture hall with 500 people, and then you go to ask that professor 2 years later for a recommendation letter, are they going to remember you and be able to talk to you? You want to know those sizes. How am I going to get to know my faculty members? Would I feel more comfortable in a small environment or a big environment? Everyone should always be asking about what kind of tutoring resources are available, just to make sure college classes move fast and the tests, come up out of nowhere and are a big chunk of your grade. So you want to make sure that if you need help, besides your professors, what kinds of resources are available on campus. And then many campuses will provide some type of standardized test prep for the tests that I mentioned on the last slide. Loyola, personally, we don't. We refer students out to other companies. But if you find a school that does offer it, that could be something to add to the pros list as you're doing your research. And then this next slide talks about asking, what type of hospitals, I know I'm going to need to do these clinical hours. Are there places I can do these in town? Do you have any formal partnerships? St. Mary's in Minnesota has a connection with the Mayo Clinic. Like, that would be amazing if you worked there and then we're able to brag about those contact hours that you achieved when you go to apply to professional school. You might ask about research. So research isn't something that's required, but many students that apply to professional schools will do research. So you might ask, like, how accessible is that? When's the earliest time that I can start research? And then last but not least, like, thinking about those clubs and service opportunities that might relate to your specific major. And then the last section is thinking about outcomes. So is there a list of professional schools that students from this university have gone to in the past? At Loyola, we have that loud and proud on our pre-health website because we're amazed at all that our students have accomplished in getting accepted to all these different places. You might ask, this is a list of 100 schools, but where do most of the students go, to kind of narrow it down and get a better idea of, if a large percentage are all going to one school, that's kind of helpful to know in your research. And then last but not least, you should be, prepared to ask what percentage of your students on the pre-health track are actually admitted into professional school. Like, that statistic might be a really important, deal breaker when you go to compare all your different colleges together. I would remind all the students and parents in the audience that after you get that number, you should ask how it was computed. So are they just looking at the seniors that are graduating and, applying to these programs? Can you only have a certain GPA in order to apply to medical school at this particular campus? So you want to make sure you dig into the data a little bit more and don't just kind of take someone's word for it that 100% of their students are admitted to medical school. Thank you, thank you. And now I'm going to pass it off to Brenda Jones from St. Mary's.
Thanks, Mary Alice. Hi, everyone. We're so glad that you joined us this evening. I'm Brenda Jones. I'm with St. Mary's University of Minnesota in Winona, Minnesota. I'm the Associate Regional Director of Admissions there, which means that I don't live in Winona. I actually live in the Chicagoland area and work with students in Illinois. That gives me the opportunity to get to meet you better, know your counselors better. I'm familiar with the schools in the area. So it just puts me in a position to be more available to you. So most of the time when I meet students that are interested in medicine or something in the healthcare fields, I always ask them what their vision is, and they usually say that they're interested in being a doctor or a nurse. And more specifically, many times they'll say, I want to be a neurosurgeon, or I want to be a pediatrician, or I want to be a neonatal nurse. So it makes sense because most likely those are the professions that you've had experience with. You go to the doctor, a nurse may help you while you're there. Sometimes students are interested in physical therapy because they've had a sports injury and they've gone to a physical therapist. But I feel like it's my job at that point in time to educate them a little bit more on other areas or jobs that are available in the healthcare fields where they're still doing patient care. So, as Matt mentioned earlier, when a student's interested in some kind of medicine or healthcare, usually they kind of gravitate towards a degree in one of the sciences. So the majority of the time it's like biology, chemistry, biochemistry. But again, like Matt said, we as admissions counselors usually encourage you to major in something that you're very passionate about, that you excel in, so that you can perform well in that major as you progress through your undergraduate work. But let's just look at a biology major. So let's say that you're thinking you're going to go into medicine and you love biology in high school, so you're going to pick that biology major. So if you take a look at the chart on this slide, on the left side, it shows what you can do with a biology major. And after you get your BA degree, you can go to professional school. Like Mary Alice mentioned, to go to professional school, most of the time you're going to take one of those entrance exams. So you might have to take the MCAT to get into medical school, or you might have to take you know, the GRE to get into pharmacy school, but that's a good path for a biology major that got a BA degree. They can go to professional school, they can take one of these entrance exams, they can do all the things that Mary Alice talked about, or with the BA degree, you might be able to go into some kind of sales, pharmaceutical sales. You might be able to go into research, or sometimes students decide with a biology major to just go into education and teach. So on the right side of the chart, you'll see some of these unique healthcare professions that I was kind of alluding to earlier, that are available at various institutions. So I'm going to highlight a couple of them that St. Mary's offers, and then a little bit later in the presentation, Grayson's going to talk about some of the things that that St. Ambrose has and some of the other schools. So let's go to the next slide. All right, so some of the professions that you could go into if you decide that you don't want to go into medicine or, you know, a doctor. One of them is that you could be a physician's assistant. At St. Mary's, we have a direct admit program that we do in partnership with Mayo Clinic. So you would do 3 years at St. Mary's, and then you would do your 2 years at Mayo, and you would come out with as a certified physician's assistant. So this is something that's direct admit. So as a freshman, you apply to this, you get into this program, and then as long as you're meeting the parameters along the way, then you would just go right into your graduate work at Mayo Clinic. You don't have to reapply. You don't have to go jump through all the hoops to get into the graduate program. And Grayson will focus on a little bit more of that later on. Then there's also pre-laboratory science. So maybe you want to go into some lab and work in a diagnostic lab or a research lab. You would do an internship in like either the medical lab science area or the cytotechnology area. And that's another option for you. There's also imaging. So you could go into radiography, which is like working with X-rays, or you could go into sonography, which would be working with an ultrasound, or you could go into echocardiography, which would be working with an ultrasound of the heart. So at St. Mary's, this is oftentimes like a 2+2 program where you would do 2 years of your prerequisites at St. Mary's, and then you would do 2 years at a certified facility. We happen to have a partnership with Mayo. So Mayo, you would then go on to Mayo to do these things. But this is something that's highly competitive. So you want to make sure that all of the prerequisites that you're doing, you're working hard and you're doing well in those, because you would have to apply then to Mayo's program or another certified facilities program. If you decide not to do a direct admit program, you could do pre-physician's assistant. So you could go to any of our institutions knowing that you wanted to go on to a physician's assistant program and do additional schooling, but you could prepare for that at any of our institutions, like doing your undergraduate work with us. There's also pre-nuclear medicine, where you would work with radioactive drugs and imaging equipment for diagnosing and research. And then there's also physical therapy. So some schools have a direct admit physical therapy program. St. Mary's actually has a pre-physical therapy program, which prepares students then to go on to professional schools and become a physical therapist. Now, with a degree in biology, you can easily move from one to the other. So you might start off thinking that you wanted to be a physical therapist, and you could easily transition over to applying and becoming a physician's assistant. So now I'm going to turn it over to Grayson and let her talk to you more about those direct admit programs.
Hi, everyone. So yes, like Brenda said, my name is Grayson Schreiner. I'm a first-year admissions counselor at St. Ambrose University, which is located in Davenport, Iowa. I actually graduated from SAU and have been in my position since 2017, so I absolutely love it. But yes, we are going to shift gears a little bit to talk about direct admit programs. So far, we have heard how to kind of apply to those graduate programs as a college student. Mary Alice did a great job outlining the criteria for that. The difference with direct admit is typically you apply as a high school senior. So on the PowerPoint listed are just some of the direct admit programs within the health science field. There are many others that will be offered at various schools. The type of direct admit program will vary from school to school. Some schools you can attend for your undergraduate degree and your graduate degree. So for example, at St. Ambrose, you can get your bachelor's degree for undergrad and then continue at SAU for your master's or doctorate degrees. Other schools will have a partnership. So in this case, you would attend one school for your undergraduate degree and then attend a different school for that specific program or for the graduate degrees. You just heard from Brenda the partnership St. Mary's has, Benedictine and Loyola will have partnerships as well. So when you are considering different schools for their direct admit programs, there are some important things to look for. You'll want to see if there is a separate application for the admit programs. There typically will be an application that is separate from the general admission application. You'll also want to know when that deadline is for the direct admit application, because typically there is a separate deadline as well. When applying for direct admit programs as a high school senior, schools will go off of your high school GPA and your ACT or SAT scores. And these requirements may be different than that school's general admission requirements as well. And finally, some additional requirements you'll want to look for are observation hours, specific high school courses, and what you'll need to maintain during your undergraduate degree, like a certain GPA. Some benefits of to direct admit programs are peace of mind with the early acceptance, since you are applying as a high school senior instead of a college student. Potentially accelerated programs that have you graduating with your graduate degree quicker, and then building relationships with professors and advising within the program earlier as well. And then on the next slide, here are just some St. Ambrose specific programs. I have noted fall 2021 because they do look different than previous year requirements due to COVID. So that's something to keep in mind when you are looking at those direct admit programs. It's also important to note that SAU's requirement for a program like physical therapy might be different from another school's requirements for their physical therapy program. So it's really important to make sure you are staying organized if you are considering multiple schools. All right, and that concludes our presentation. We now have some time for questions if you'd like to start sending those in. We may not get to all of them tonight, but we will be given a list of all the questions so we can answer them in the near future. And then if you would like to jot down our contact information, we'll leave that slide up while we're answering the questions. All right, so one of them was specific for medical school, if your high school courses matter when you're applying for that medical school. So outside of direct admit programs, the high school courses typically won't matter for the graduate program that you're applying to. However, the high school courses you take set a foundation for your undergraduate degree. So if you have a lot of biology courses, chemistry, physics, if your anatomy and physiology is offered during high school, that will be a strong foundation if you take those for then those college courses that you'll be required to take in order to apply for medical school.
A couple people are hopping on and are kind of bouncing off of that question, and they're asking, like, what specific high school courses are going to set me up for success in this. And so since many of the prerequisites that are required are like your math and science classes, I would say for most cases, it's a good idea to like keep up with those for all 4 years and to make sure that you're challenging yourself. During senior year, it's really easy to be like, it would be cool to leave early and not take calculus. But I think all of us here would say like, you know, taking a break from math, then it's really hard to get back into it when you get on that college campus. So I would stay committed to those areas just to make sure you go into college, wherever you go, with that really strong base foundation.
All right, so this question was, can you change your major if you want to, if you are kind of on the pre-professional track? Which Brenda, you kind of mentioned that, so if you wanted to maybe go a little bit more into detail.
Yeah, sure. So many times with, you know, the biology major, a chemistry major, a biochem major, you're going to be taking all the classes that you need to, you know, get into these professional schools. So it's not like you have to, at the very beginning, decide, well, I'm going to go to medical school, and then when you're partway through, you think, ooh, maybe I don't really want to do that. Maybe I just want to be a physician's assistant, or maybe I want to be a physical therapist. It's really easy to switch just because almost all those prerequisite classes are going to be very similar. So, so you don't need to decide right in the beginning what path you're going to take. It's kind of easy to jump from one to the other.
All right, thank you. Another question was if a calculus math class in high school, if it's needed to meet requirements for a bachelor's degree. So that kind of depends on the degree that you're going for. I know, like specifically for St. Ambrose, direct admit program for physician's assistant does require through high school calculus. Now that is the direct admit program. However, I do believe if you didn't do that direct admit program and just like kind of started your undergraduate degree and then applied as a college student, the college calculus would still be required for the physician's assistant graduate degree. So it kind of, again, just depends a little bit on what major you're wanting to go in and what graduate program you're also then going to be looking at. Anything else to add to that, guys?
No, that was great.
I can take a couple of these. So one of the students is asking, should we be doing volunteering or shadowing while in high school? I think if you have the opportunity to do that, that always kind of solidifies whether or not you enjoy the work, or at least it opens up your eyes a little bit more to what the profession is like. I think the more you expose yourself to it, the you know, the better you're going to know whether or not this is something that you want to do for the rest of your life. So I think if you do have the opportunity to do that, it's only going to help you in the decisions that you make on what you want to do. I know it's a little hard right now with everything that's going on to find those opportunities, but it's certainly worth looking into and seeing what you can try to find. Also, one of the students asked about contacting undergraduate admissions counselors regarding, you know, an interest in following a pre-dental track while they're a junior in high school. Our contact information is on here, but any school, if you go to their website and go to admissions, you can type in, you know, admissions counselors and they'll pop up. Most of the time, they'll tell you what area they service. So like for instance, I work with all students in Illinois. Sometimes undergraduate admissions counselors will have a variety of states, so you can kind of look through their profile and see what admissions counselors would work with students from Illinois. But all of us are here for you, so we're happy to have you contact us, and we're more than willing to answer your questions about what you have about, you know, different tracks that you want to take.
There are couple questions I see about direct admit programs. So One of them is if you go into a direct admit program and get in, but then decide later on to switch to a different graduate program, are you able to? Which, yes, you are absolutely able to. It is also easier, like if you do decide to switch to another healthcare, like if you're switching within the same health sciences, like from physical therapy to occupational therapy, that is going to be a little bit easier because they will typically require a lot of the same prerequisites. So then a lot of whatever your original program that was chosen, those classes will still count for the new one that you choose if it's within the same kind of department. However, I will point out that you would have to still you would still have to apply for that new program. So just because you get into the direct admit for one of them doesn't mean that you are for the other one. So you would have to still apply for that new program. And then with the other question was about what your focuses should be for those essays. And like what would attract you. So when it comes to applying for direct admit, especially as I think a high school student, it's really important to focus on not just why you are wanting to do like physical therapy or occupational therapy, but also why you're wanting to do it at that specific school. So why, like what draws you to like St. Ambrose, for example. So I think personalizing it may take some additional time if you're applying to a lot of schools, but personalizing it will make you stand out more as opposed to it looking like it was an essay that you sent to 4 other schools as well.
There's a lot of questions where students are telling us all the amazing stuff that they're already doing as high school students, like volunteering in hospitals, getting their CNA. And someone asked, should I share that information in my essay or in my resume? And I would say you could share it in both places. If you're gonna make it part of your essay though, it should be part of like a bigger narrative. So your essay shouldn't be, Tuesday I went to the hospital and I volunteered. It should be, here's what I learned from my volunteering experience, or here's someone that I met while I was volunteering that was like really impactful for me. All 4 of us are schools where we're literally, like, it's why I have classes. We're reading every single page of your application when we're making those admission decisions. So the more you can tell us about you now, the more we can get to know you and help you connect on our campus. Like if I read that someone's really passionate about doing medical service, I'm like, oh my gosh, we have so many ways you can do that here at Loyola. Can I tell you about them? So it kind of helps us get to know more about you when we're reading your application, but it can also help us help you figure out if this specific institution is going to be a good fit for you if you want to continue some of those extracurriculars. For when you apply to medical school, you would probably just have that in your resume. Usually the essays for most health professional schools are a little bit more like directed. So you might be able to work it in somehow, but they would definitely see any like contact or volunteer hours for professional school when you're done with college and applying on your resume for sure. Matt, there was someone that was asking, does Benedictine or Loyola have a pre-dental program?
Yeah, I can answer that, and I know we've had conversations. So at Benedictine, we do have some partnership relationships for guaranteed interviews and processes with Midwestern University for pre-dental, pre-optometry, and then pre-pharmacy. And then we also have a relationship with Lake Erie Osteopathic Medicine in Lake Erie, Pennsylvania. And they just opened up a campus in Bradenton, Florida for early acceptance for dental, pharmacy, and medical.
And Loyola has a pre-dental track, but we do not have a dental school, and we don't have a partnership with a dental school. So when you go to apply to dental school, our pre-health advisors are going to take care of you. But even if you love Loyola, you can't stick around with us for more school for dental school because we don't have that, unfortunately.
I know there was a couple questions regarding AP credit. You guys are okay. I would like to answer that one, as we do get a lot of that. So many of you probably have or will have the opportunity to take AP coursework. What we see many times is students will either take Calc AB or BC. We definitely strongly urge that from that perspective. And those credits will count towards graduation requirements, meet some prerequisite requirements. But really for many professional schools, it does vary in the sense of how they view some of those courses. So For example, if you were a psychology major and come in with biology or chemistry AP credit, that professional school, with you being a psychology major, may still want to see you take some advanced biology courses to really see a good coursework within kind of your realm on your application and through your transcript of courses taken at university level. As we see, many of our biology STEM majors don't have anything to worry about when they bring in AP credit because they're taking some of those advanced cell biology courseworks and some of those things as part of the major.
And I would say, like, even if you have to retake a class on a college campus because a medical school wants to see that you've taken biology, like at Loyola or at U of I or at St. Ambrose instead of through AP, like if you've challenged yourself with the AP, statistically, it's so much more likely that you're going to get a strong A or a high B, you know, in that class because you've already done it. So you should all really be thinking of like, how can high school best prepare me for what's ahead, and kind of, you know, challenging yourself within reason. You know, don't overload on these things and stress yourself out and, you know, have C's in all your AP classes. But I would say, like, if the opportunity to challenge yourself is there and you feel ready for that challenge, you should definitely take it on, even if you might have to, you know, retake it because a medical school doesn't, you know, wants to see it on a college campus later on. There's some questions coming in that are like, how could I visit a campus during the pandemic? Do we want to like all go around super quick and give our soundbite answers for that?
Yeah.
At Loyola, we're open for very limited socially distant visits. So you can sign up to come and see us Monday through Friday, many Saturdays. And then we are like online just all the time. So, you know, if you go to our website, you can see a whole variety of ways that you can engage with us online as well.
So at St. Mary's University of Minnesota, we actually are doing on-campus tours right now. We do have protocols in place. You have to wear a mask. Students are only allowed to bring 2 guests with them. We are not touring our residence halls just for the protection of our current students, but you are allowed to go in some of the buildings on campus with our tour guides. But a lot of what we're doing right now is virtual. So any student can schedule a virtual visit, and we are actually giving a $1,000 scholarship, which is per year, if you do a virtual visit your senior year.
Grayson or Matt?
I'll go. Sorry. We for our in-person, we are offering in-person visits as well, and ours are very similar to Brenda's at St. Mary's. So you are required to wear a mask. We are social distancing. We are giving campus tours where you are able to go into some of the buildings, but we are also excluding residence halls. And then again, we also have virtual visit options as well. So we'll have some individual ones, and then we'll also have like a group ones, kind of like our typical Saturday group visits. We'll have some options for virtual.
And then here at Benedictine, very similar. We do have the opportunity for personalized visits Monday through Friday. That allows students to come in a socially distanced manner. Masks are required, but we do feel, especially for our science students, an opportunity to see our lab spaces and the instruments and kind of how those things are viewed from that perspective, and just kind of walk campus as a whole and sit down and have a conversation with your admission counselor. And then we have our virtual opportunities, which consist of anything from a more more in-depth conversation about Benedictine's pre-health, as well as major opportunities, student panel drop-ins, as well as virtual one-on-ones with your admission counselor. So a wealth of opportunities from that perspective as well.
A lot of people are asking, like, how do I find a volunteer opportunity? So unfortunately, like, we don't necessarily know where all of you are, so we can't recommend like a particular hospital or clinic. But oftentimes, if you actually talk to like your high school guidance counselor, they can sometimes recommend, like, here's where students have volunteered in the past. Right now, you're going to high school in a pandemic. So if you have not done extensive volunteer work, like, we're gonna give you a pass because we're not living in normal times right now. So don't panic too much about that, but you can also like reach out to any of us individually if you have specific concerns there.
And for observation, sorry, Matt, for the observation hours, you can typically just call like like if you're doing physical therapy, you just call the physical therapy office, mention it to the front desk person. They will usually know who to pass you off to get those observation hours in.
And even from our end, we always urge and talk about, right, that this volunteering with youth and different populations are a huge positive, even if it doesn't have a direct correlation with healthcare, because it allows you to kind of start building that resume of a level of involvement. And really also, I think it also helps shape and show what kind of age group you want to work with, right? We always talk about different opportunities, right? It's, do you want to work with a younger population, an older population? Do you want to work in a private sector, a clinical setting, a hospital setting? So, right, even as a high school student, right, you have those opportunities to work with a youth population, even if it's a tutor or something, some of those capacities that can kind of stem and help build before you step foot on a college campus.
All right, everybody, that went so fast. I hate to jump in. I'm just to protect time. I just want to thank everyone, for our panelists, for all that amazing information and support. Participants, if they didn't get to your question, hopefully you jotted down their contact information, but they also will get that transcript and have chances to reach out directly to you. So just quickly as we leave, as you exit the meeting, you will get a quick survey. We'd love your feedback on the meeting or the event. And then just don't forget that there are lots of other sessions available, so feel free to check them out at iacac.org. Thanks, everyone. Have a great night.
Thank you.
Thank you. Take care.
Bye.
Great job.